We are trying to build the next wave of innovation around patient engagement. With one large MCO client, we've tripled primary care visits. We have more than doubled cervical cancer screenings and mammograms.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. Here with my guest today, Matt Swanson, CEO and founder of Reciprocity Health. Great to see you, Matt.
You too, Logan.
It's exciting to have you here. You have, I interview a lot of founders in this space, and not everyone has big news to share. So I know you've just had a raise. So tell me about what you've built. So give me the pitch of Reciprocity Health, and then we're going to jump into your raise.
Yeah, it's been an exciting year for sure. So our first commercial year was just completed in the end of 2023. So
You're just 1 year old.
1 year old.
Okay.
We got some commercial product out in late 2022, but our first full year was 2023, and offered a lot of proof points for us. So that was really an exciting time for us to start seeing validated information come out of the platform and the work we were doing. And that enabled us, as we closed the year, to raise our next capital round, which was really exciting. A lot of work. It's a tough process these days, but having that foundation of data really helped. Having the commercial validation and great client satisfaction helped. But I think overall, it was really a lesson in perseverance more than anything.
Yeah. Okay, let's back it up. What is Reciprocity Health? What are you building?
So we are trying to build the next wave of innovation around patient engagement. We're doing that with a very unique digital approach, great technology behind it, but really it is about the service behind that technology. We have a team of behavioral economists who design programming for any type of episode of care, chronic condition management, transition of care, and we deliver that through an app, but also bundled with financial incentives. Financial incentives are a CMS field-tested approach to engaging members in their care, and they proved in 10 states field testing the effectiveness of paying people to adopt and adhere to their programming if you are delivering financial incentives along the way.
Okay.
It's a very powerful programming, but it is very complicated. So building a platform and a team able to do that work was really the challenge at the outset.
Okay, so walk me through, I think for a lot of folks, they're going to be thinking, wait, I could get paid to do healthy actions. Walk me through the types of use cases for incentivizing healthy behaviors.
Yeah. So we do everything from full population programs around your standard preventative care, getting your annual wellness visit, lab screens, mammograms, cervical cancer screens, et cetera. So getting people participating in the annual approach to just being healthy is one application. But the way we do that is through a digital outreach and a very personalized approach. So it's not just a blanket program that you might be able to participate in. We approach each individual, telling them exactly what they are eligible for and giving them the steps through the app to actually help them complete that. Okay. So that personalized approach is very important. But where we're going, where no one else does, is taking financial incentives and the power behind it into more complex care journeys.
Okay.
So there might be a diabetes management program, for example, that is a 6-month program that involves all sorts of different steps like attending classes, weigh-ins, visiting your doctor and updating them with a diary of your activities, checking in week to week so that the clinicians can see exactly the progress you're making and how you're feeling, so those feedback loops. And what we do is we breadcrumb that entire curriculum with incentives along the way. So you might start the journey with just 5 activities ahead of you. Makes it less intimidating. You're not looking at 6 months of work. You're looking at these are the next 5 steps. Here are the simple ways to complete those. Some of those are rewarded immediately. If you fill out this screening tool, you'll get $5 loaded to your card immediately.
Okay.
Others, like a primary care visit or a lab screen, will reward when that screen actually shows up with the payer through claims or in their care navigation system.
Okay.
So you're really taking a standardized care delivery program and creating this overlay of financial incentives and instruction to make it a more compelling and rewarding on-ramp into your care.
Okay, 2 questions. One, how compelling is it? You said it's been validated, it's been studied. How compelling is it to give $5 here, $5 there? What kind of outcomes can you show to the people who you work with?
So what you're really doing is breaking it down and making it a simple 2 or 3 steps to get started. So you want to build that confidence and momentum. But you're approaching it by telling someone that they can earn hundreds of dollars in the overall program, and then showing them the progress they're making towards that overall reward. So the prospect of a reward, a sizable reward, is very compelling to draw people towards their care, especially if you're approaching the family as a household. We have certain Medicaid families that are earning $700-800 in total rewards for the family just by doing the gap closures, the preventative care that we talked about. So
over the course of a year?
Over the course of the year.
Yeah, okay.
So what we do is we have very specific outreach to those families, making sure that they have an easy registration process and can flow into the program really easily. And then create a couple of easy early wins for them so that they can actually see that the rewards are coming. And we've had great success, not just with enrollment, but in follow-through. With one large MCO client, we've tripled primary care visits. We have more than doubled cervical cancer screenings and mammograms. And so the evidence that I talked about of really being able to prove out that you're driving that level of adoption is incredible. And then when you look at something that historically is quite overwhelming, a long-term chronic condition program like diabetes management, we've been able to reach out to members as they come in and are receiving that diagnosis from their clinician and getting that clinician to sign them up for the program. And there we have over 80-90% enrollment rate into the program because there you have your clinician saying, this is what's going to be healthier for you, and you can actually be earning rewards as you go. Okay.
The cash that they get, it gets put on a special card to be spent in a certain place? How does that work?
So that's up to the client to design. At a minimum, we put restrictions on the card, so alcohol, tobacco, firearms, gambling don't work with the card. But then we can get more directed. If it is meant to be only spent on nutritious food, we can do that. If it's meant to be spent for transportation to care, it can do that. Our behavioral economics team will tell you that the freedom to spend it where it matters most to you is the most compelling piece. But we can really have the flexibility on a case-by-case basis to let that card be the most compelling piece for someone to participate in their care.
Yeah, you pull away that incentive, and all of a sudden the whole house, the whole house crumbles.
Right.
If it's not actually a compelling offer.
Exactly.
So let's talk about your raise. What was the amount that you raised?
So it's between $5 and $6 million.
Okay.
We did some initial raise in 2023, and then we're able to complete this with the larger round completion with Impactful Capital, which is a great partner. They are very mission aligned with us, looking at whole person care, understanding what digital health and engagement can mean. And we worked with them over a series of months to get this completed. A very thorough, very professional due diligence process. Yeah. I think all the firms out there are really tightening the screws on making sure that their investments are well grounded, and that we were able to deliver what we said we could do.
Yeah, so I was going to say the $1 million question. The $5.5 million question is why you were able to close when there's a lot of folks out there who are really struggling to close. Was it primarily just the right product at the right time, the team, the connections you've had from previous work that you've done? What are some of the ingredients that came together for a successful raise?
I think two main compelling points. Number one, we were really lucky / thoughtful about how we raised capital to start. So we really stage-gated our progress and only raised enough capital of what we needed to reach the next milestone of validation and technology build throughout 2020 through 2022. And that approach led us to really incrementally raise our valuation and not go for broke and get some really inflated valuation that becomes a burden later on when you're fundraising. So being in that position and in 2023 being in a position where we had a valuation that we had grown into and possibly exceeded really helped. I think a lot of companies out there are burdened by that, that they have a large valuation that when all of a sudden the focus shifted from innovation and into revenue multiples, for example, that gets you caught in a really tricky spot. So we didn't have that issue. We had real revenue. We were growing. We had a clear trajectory towards break even, which is very important. But the second piece is just flat out perseverance.
Yeah.
The number of meetings we had, the depth of conversations that went on weeks, if not months, with an assortment of investors. It takes a lot of time. Luckily, we had a deep enough bench to be able to run the company and get great results at the same time of running this process. But we were running out of gas because that's a lot of energy going into two very important sides of the business. And certainly having the capital is important, but the real dividend for me and the senior team is that we get a lot of time back now to put into growing the business and driving client success.
Now, I know you've been an entrepreneur for a long time. You were in e-commerce, you worked in education, so you learned that persistence, and how to develop these deals. But you're relatively new to healthcare. Is that fair to say?
10 years in.
10 years in. Okay. So I guess as an entrepreneur, as a founder of a healthcare company,
3 or 4 years.
3 or 4 years in, and I'm wondering what you have learned about what's unique about the persistence necessary in this market versus your previous experience.
Yeah, I think the client side is very different because you do need to reach those commercial validation points of contracting and revenue. So there are longer sales cycles, which makes that more difficult. And then, especially when you're talking about chronic condition management, those proof points, even once you're into a contract, are still a ways out. I would recommend to entrepreneurs who are getting to that contract cycle to try to pick projects that are going to yield early validation points. If you can focus on something with driving down hospital readmission, for example, that's something that you can validate on 30-day cycles, right? As opposed to diabetes management, where you have something that's really over the horizon that's really going to be able to pay off in terms of data. So if you do have the luxury of trying to pull in something that has a shorter horizon, that's really, really helpful so that data can be available. I think, in healthcare specifically, if you do have a specific client set, whether it's payers, health systems, or other solution providers, really trying to focus on one specific set and become an expert with that group is probably the best way to go. Because if you're trying to serve 3 or 4 different masters and you're getting pulled in a variety of different directions, it can get really, really hard to drive the outcomes you need and those proof points you need if you're trying to move the ball on 4 different fronts.
Yeah. Quick last question. What are you most excited about for the next 12 months in terms of milestones for the company?
Well, we've got rolling out in 3 new states in April, which is really, really exciting. And we're moving into different client sets. We've built new technology. We've been exclusively focused on payers. We're now moving into ACOs and health systems, which is exciting. If you think about payer populations, we're given a roster of members with all their contact information. Go find these folks, go find the inactive folks, and we go after them. In the ACO and health system world, they don't have a population to manage. They're meeting people and maybe giving a diabetes diagnosis on the spot. And letting those clinicians sign someone up for the program in real time is a new development for us. So being in that format opens up a whole new horizon for us in terms of clients, and it's really exciting.
That's awesome. Well, Matt, excited to see what you're building, excited about the raise, but more excited about your persistence to push on this challenging and such an important area of health innovation. So we'll be watching as you develop in the next year. So thank you.
Thanks, Logan.
All right,
Appreciate
thanks,
it.